Okay. I'm Labibah Swalhi, a third-year medical student, and today I'll be going, inshallah, through the enzyme kinetic lecture. Can you all hear me and see my screen? Okay, perfect. Thank you. Okay. So as I go through, if you have any questions, please feel free to leave them in the chat box, and if I go fast, please remind me. So the objective of this lecture would be comparing enzyme kinetics, describing Michaelis-Menten model, and then outlining the linear Brooke conversion or the reciprocal plot. Then we would explain the Km and Vmax values. Also, we would describe allosteric enzyme and how are they different from the Michaelis-Menten enzymes. Also, we'll go over the effect of inhibitors and different type of inhibitors on the enzymes. And finally, we'll correlate all of this to some of the clinical insights. Generally, we have three more important concepts we have to cover, which is the Km and Vmax, and allosteric enzymes and inhibitors. So basically, because the lecture is about allosteric enzymes, I mean about the, just a second. Okay, so because the lecture is about enzyme kinetics, first we need to understand what does enzyme kinetics mean. So it's basically when we say a kinetic of an enzyme, we mean the speed of the reaction or the rate of the reaction at which the enzyme can carry this reaction, and what would happen if we change certain component in this reaction. So for example, if I add more substrate or decrease the substrate, how the speed of this reaction would change. And one of the model or one of the equations we use to study the enzyme kinetics would be the Michaelis-Menten equation. So it's very simple, and we have one principle we have to put in mind when using the Michaelis-Menten equation. So, and that is, let's say you have 10 millimole of an enzyme X, and then you take this enzyme and added 10 millimole, you added your substrate, and you want to study the velocity or the speed of the reaction of this enzyme. The result you get are only applied to 10 millimole of this enzyme. You can't apply this the result you get to a 20 millimole of the enzyme X or a 5 millimole of the enzyme X. And as we go further, I'll explain for you why is that. So here you have your enzyme, you have your substrate, they bind together and give you the enzyme substrate complex, and this is unstable or transient state if you want. And that's the arrow is going in this direction, and it's noted as K1. Then enzyme complex, the enzyme substrate complex will give you a product, and the enzyme can be utilized again, another substrate. This is K2. When enzyme substrate complex go back and reverse to separate substrate and separate enzyme, this is denoted as K-1. And when the product and the enzyme bind together and go back to the enzyme substrate enzyme complex, this is K-2. So basically, you said enzyme kinetics is all about speed and reaction of the speed and rate of the reaction. And so we measure it by seeing how much unit of the substrate disappears per unit of time, or how much products appear per unit of time. Okay, so now I will explain the difference between the initial velocity and the Vmax or the maximum velocity in this graph. You see here the y-axis is representing the product, and the x-axis is representing the time. Now this graph is made for to show the velocity of the reaction, but for the time being, because I want to explain the initial velocity and the Vmax, let's assume the x-axis is showing the substrate concentration. So you see here, we started from 0, and as you see, we started to add more substrate, and the product here is increasing, or the velocity is increasing. And as we add more, the velocity is still increasing until we reach here. At this point, we are still adding some substrate, but the velocity is not increasing as much as it was increasing here, or it's increasing less and less. And then we continue and add more substrate, we add more until we reach a point, no matter how much we increase substrate in the substrate, there is no increase in the velocity or the product. So this point here, from this point till this point, where the increase in the velocity is proportional to the increase of the substrate, we call it the initial velocity. And when we reach this point here, where no matter how much we add substrate, there is no increase in the velocity, we call it the maximum velocity or the VMAX. Now in the lab, when they want to measure an enzyme kinetic or the speed of the reaction, they have two ways to measure it, either in a discontinuous fashion or a continuous fashion. So basically, in the discontinuous fashion, they will add their enzyme, their substrate, and they mix them together after a set period of time, they will obtain the measurement. So for example, they are adding their enzyme, their reaction, then after 10 seconds, they will take the measurement. This is a discontinuous fashion. The continuous fashion, they will add their substrate, they will add their enzyme, and they will be obtaining a measurement at each and every point of time. So at 1 second, 2 seconds, 5 seconds, 10 seconds, and etc. Also for the machine, to make it easier for the machine to follow the reaction, they add chromogen. So chromogen, when it gets catalyzed by the enzyme and yield a product, the product will be colored or fluoresce. So that's the concept behind chromogen. Okay, now to our first important concept that we need to cover, which is the VMAX and Km. So I said enzyme kinetics is all about speed. So when we study enzyme kinetics, there's two parameters that we need to describe or interpret, and those are VMAX and Km. Okay, and I'll be explaining them now. So for the VMAX, as if you remember when we explained it here, we said it's the point where adding, no matter how much we add substrate, there is no increase in the velocity. Basically, we reach the maximum velocity the enzyme can get or can reach. So let's say you have a container here. And you have 4 units of the enzyme. You're adding 4 units of enzyme. I'm using 4 units, so 4 enzymes, but in real life, 1 unit doesn't mean necessarily 1 enzyme, but I'm using this just to explain the concept. Now, and here our graph. So 1, 2, 3, 4, and 1, 2, 3, 4. It's not accurate, but it's okay. So okay, I'm adding 4 enzymes. Now let's say I'll add 3 substrate, 1, 2, and 3. Now each substrate from these will bind to 1 enzyme and we will get a product. So at 1 substrate, we get 1 product. At 2 substrate, we get 2 products. And at 3 substrate, we get 3 products. Now, can we say that 3 products, or at this point of time, or at this point of the graph, would be the Vmax for a 4 unit of this enzyme, based on the definition I said earlier? No, perfect, mumtaz. Okay, now why? Because we have still a free active, 1 free active site. So which means if we add more substrate, this substrate still can be converted to a product and we can get 1 more product. Now we reached 4. Now, can we say that at this point of the graph, this would be the maximum velocity for a 4 units of this enzyme? Yes, perfect. Yes, we can say that. Why? Because all the active sites are occupied. So no matter how much I'm adding more substrate, these substrate will not be catalyzed until an enzyme convert its substrate to a product, then the second enzyme will come. However, at the same point of time, no, because all the active sites are occupied. Okay, so where is there? Okay, now let's say I'm adding in the same container 2 more units. Excuse me. Okay, I'm adding 2 more units of this enzyme. Now, can I use this graph here or this plot and say at this plot is applied also to 6 units of this enzyme? and the VMAX for 6 units of this enzyme is the same point for the VMAX for 4 units. No, ممتاز. Yes, we can't. Why? Because when we added 2 enzymes, basically, what does it mean? That we added more 2 active sites. So if we add more substrate, those substrate will be catalyzed and we will get a product. So, so this graph cannot be utilized to 6 units of the same enzyme. So that's why I said earlier in Michel's-Menten equation, each graph is represented for a specific concentration of the enzyme. That's it for VMAX. I hope the concept is clear. Now to KM. Okay, so now for KM, let's say we have 2 enzymes, enzyme A and the enzyme B. Let's say enzyme A has a lower affinity for its substrate. However, the enzyme B has higher affinity for its substrate. I'm adding 4 subunits, 4 units of enzymes. Here is our graph. Okay. Okay, so Km, the definition of Km is how much substrate do you need to reach half of the Vmax? Okay, so for this enzyme, for the A enzyme, which has lower affinity, let's say I'm adding, let's say 4 subunits, so Vmax, yani, probably would be 4 products. At Vmax, we will yield 4 products. So you assume at half Vmax, you will yield 2 products. So you just need to add 2 substrate so that you can get 2 products, and 2 products is at the same point of half Vmax, right? So now if I'm adding 2 substrate, we are assuming now when we add 2 substrate, we are assuming that those 2 substrate will go and bind to their corresponding enzyme. But this is not true. Because what are the chances that those 2 substrate will go and find their enzyme and bind to them? Not very high, especially as we said, the enzyme has a lower affinity for its substrate. If you want to imagine and make it clear, let's assume that the enzyme is like a magnet and the lower affinity substrate is a wood and the higher affinity substrate would be a metal. So now my 2 substrate that I added, they may and none of them would bind to the enzyme, or maybe one of them. So let's assume when we added 2, one of them bound to one enzyme and the other one didn't. So at 2, and our half Vmax is 2. So at 2, only one product. We yield only one product. So we added 2 more. And when we added 2 more, the second one bind to its enzyme. And at 4, we yield 2 products, and that's half Vmax. This is for the enzyme A. Now, back to the enzyme B, which we said higher affinity like a metal, and we can compare it like a metal and a magnet. So the enzyme would be the magnet and the substrate would be the metal. So we are adding, it's the same here. Let's assume that the 4 active sites, so 4 products, so half of Vmax. So the Vmax is 4, half Vmax would be 2 products. So let's add 2 substrate. And now, because this enzyme has higher affinity to its substrate, they actually, those 2 substrate would bind their enzyme. So by adding just 2 substrate, we can reach half Vmax. So at 2, you reach to half Vmax. So now Km for enzyme A would be 4, because you added 4 subunits in order for you to reach the Vmax. However, the Km for enzyme B is 2. So, a higher Vmax, a higher Km would mean lower affinity of the enzyme to its substrate. A lower Km would mean a higher affinity for the enzyme to its substrate. Now let's say I'm designing a drug, and the drug is the is a substrate or is a substrate, and this substrate would inhibit an enzyme. So what would be better, making the substrate a higher Km substrate or a lower Km substrate? Higher. Yes, exactly. We want it to be a higher Km so that we only need a fewer amount of this substrate to achieve our effect or the inhibition of the enzyme. And that's why in drugs, they choose higher Km over lower Km. So they just prescribe or give tiny amount and we avoid side effects. Okay, now that's it for Km and VMAX. I hope the concept is clear. No, actually it's higher. When we have higher Km, the affinity would be lower. No, I mean, you are right. Wait, I get confused as well. So if we want to give a higher affinity, we want the substrate to be to has higher affinity to its enzyme. So meaning lower Km. Yep, you're right, Amani. If it has lower affinity, won't it work less efficiently? Yes, if it has lower affinity, higher Km. Now, when you say lower or higher, specify lower Km or lower affinity, higher Km or higher affinity, because they go in reverse. If you said higher Km, you are meaning lower affinity. So the enzyme, it's hard for the enzyme to find its substrate. Lower affinity, higher Km. Yes. So as we said, the example of metal and a magnet. So they has higher affinity for each other. If you put a metal here and the magnet was here, they can find each other easily because they has higher affinity. And you only need one magnet, and that will be enough for it to find its enzyme. You don't have to add, for example, 3 substrate to increase the odds of one metal finding the magnet. Adding one magnet would be enough because they have higher affinity. And lower Km. Lower Km means you needed tiny substrate. You needed fewer amount of substrate. Is that clear now? Okay, perfect. Here's the same thing. And repetition of the Michaelis-Menten equation. We said Michaelis-Menten equation, we use it to study enzyme kinetics. And here's the equation here. Okay, now we said Michaelis-Menten equation, there's a graph, and from it we obtain the Km and the Vmax. But sometimes it's harder for us to obtain a Vmax from the graph. I forget to mention that Km stands for Michaelis-Menten constant, and basically it's a constant. So for example, if you have any enzyme, it has a constant affinity. It's not changed. So Vmax only the one we obtain it, and we measure it basically. Okay, so sometimes in the graph it's harder to find Vmax. So we took the reciprocal of the Michaelis-Menten equation and we plot it here, and by this we can get a straight line, and from this straight line it's much easier to find the Vmax, Km, and the other. So here you see from the reciprocal or from the double reciprocal or Lineweaver plot, you see the slope from the slope of the line is Km over Vmax. The y-intercept is 1 over Vmax, and the x-intercept -1 over Km. Now, We will get to this. This is very important. Why? Because that one of our objectives would be comparing inhibitors and type of inhibitors on enzymes, and we can know the mode of inhibition or the type of inhibition just by looking at the reciprocal graph, and we'll get to it later, inshallah. Here is it's giving you some examples of some enzymes and their Km for different substrates. Okay, now here let's take an example of isoenzymes that has or that have different kinetics. So basically, isoenzymes, we know that those are enzymes that catalyze the same reaction. However, they're distributed in different tissue and have different kinetics. So for example, we have glucokinases and hexokinases. Both of them convert glucose into glucose 6-phosphate. Glucokinase is present in the liver. Hexokinase is present in all tissue. Now to the graph here, you see the red one is the glucokinase, the blue one is hexokinases. Now you see the Km for hexokinases is almost at 0. However, the Km for glucokinases is at 10. So what does that mean? It means that hexokinases has higher affinity for its substrate. What's our substrate? It's glucose. So that means even at the presence of fewer amount of glucose in our blood, hexokinases can still work and take this glucose in any tissue, in any cell, and convert it to ATP to get energy. However, a glucokinase cannot do that unless we have higher amount of glucose of glucose in the blood, because it has low affinity, so it can't take any tiny amount. You have to have higher affinity. You have to have high amount of substrate, so you increase the chances that this enzyme find its substrate and the reaction happen. So unless there is high amount of glucose in our blood, glucokinases doesn't work. That's why the primary source for energy in the liver is not glucose. Otherwise, glucose in high or unstable or lower glucose status won't be able to get its energy, and liver cell would die. So the primary source is fatty acid instead. And okay, that's for the Km and the difference between the two. Now VMAX, Vmax for glucokinases is very high. However, the Vmax for hexokinases is low. So what does that tell you? Now hexokinases, when it takes glucose, it basically it gets from it ATP for the cell to use it as energy. However, glucokinases, when it takes glucose, it converts it into glycogen. And as we said, the glucokinase enzyme doesn't work unless we have higher amount of glucose in our blood. So we don't need this excess glucose in our blood, and we want it to be stored as glycogen, and we want it to be corrected rapidly, because high state of glucose in our blood is not good, as low state of our glucose in blood is also not good. So we want an enzyme that take action rapidly. So we want it to be corrected quickly. So we want an enzyme with higher velocity, higher Vmax, and that would be a glucokinase. So that's also why glucokinase has higher Vmax. Is this clear? I hope it is. Okay. Okay, perfect. Okay, let's repeat. Now, we said Km and Vmax are two values that are different in glucokinases and hexokinases. Okay, we repeat it, no problem. Now, when you see hexokinase has lower Km, what does lower Km mean? It has higher affinity. So it means, yeah, higher affinity. What does higher affinity mean? It means even if you have fewer amount, 1, 2, 3, 4 glucose, hexokinase can still find them and can use them to get ATP or energy. Okay. So that's why it's present in all cell tissues, because all cell tissues depend on glucose, and they want it to get energy. However, glucokinase has higher Km. So it's very hard for this enzyme to find the glucose unless there were higher amount of glucose in the blood. So it's it's very high that it's easily can be found by the enzyme. So liver, basically at fewer amount, when we have, for example, just let's say, this is not true. The values I'm giving throughout the lecture is not true. I'm just giving it to explain the concept. So let's say we have 5 glucose in the blood. Hexokinase would be able to work. However, glucokinase wouldn't be able. However, if we have 50 molecules of glucose, now glucokinase would be able to work because they are a lot and they can find the enzyme. That's why liver doesn't depend on glucose for its energy source, because it can't utilize it unless it's present in high amount. So what if we have and when I say high amount, doesn't mean normal amount. It's really high amount, excess amount, not the normal amount. So if and normal persons have normal amount of glucose. So what will happen to the liver cells if they cannot utilize glucose at this amount? They will die. That's why the primary source of their energy is fatty acid oxidation. This is for Km. Is that clear now? For the Km. Okay, perfect. Now, the glucokinase, we said when it glucokinase, what does it do? It takes glucose and convert it or build it into a glycogen store, because we have excess. First, we said it doesn't work unless we have excess glucose, and we have excess glucose. Basically, we don't want it to stay in blood. We want to get rid of it, store it, or do whatever. So glucokinase will come and take this glucose, this excess glucose, and as opposed to hexokinase, which may take 1 or 2, glucokinases take a lot of glucose, not 1 molecule, not 2, not 3, because it needs to store it. So we need more units of glucose. So it will come and take this glucose, convert it into glycogen. And we said hexokinases has lower affinity, not affinity, I mean VMAX, has lower VMAX compared to glucokinases. Vmax means velocity, or the maximum speed, higher capacity of the enzyme. So that's why when we have excess glucose, insulin gets secreted from the pancreas. It activates glucokinases. Glucokinases start to work and take this excess glucose from our blood, because it's harmful when we have hyperglycemic state. And glucokinases, because we have excess amount of glucose, we don't want an enzyme that take only 1 glucose or 2 glucose molecule. No, we want an enzyme that take action rapidly and take higher amount of glucose to store it. And that's what does Vmax, high Vmax in glucokinase mean. Now, is this part okay? Is it clear for the rest? Okay, perfect. Okay, let's move. Okay, here's an example of how we can use Km and higher or lower Km. So people, when people drink alcohol, basically alcohol gets metabolized into acetaldehyde. And when we have acetaldehyde in our blood, symptoms of hangover appear, such as high heart rate and facial flushing. So, and if we don't acetaldehyde in our blood, these symptoms won't occur. Now, acetaldehyde gets converted into other metabolites that won't affect or make any symptom appear by acetaldehyde dehydrogenase. Now, we have 2 versions of acetaldehyde dehydrogenase. Some people have low Km, and other people have high Km acetaldehyde dehydrogenase. So the low Km version means it has higher affinity for acetaldehyde. So even if we have a tiny amount of acetaldehydes in our blood, it will the low Km acetaldehyde dehydrogenase, it will take them and convert them to another metabolite. So we won't have the symptoms of hangover, no rapid heartbeat, and no facial flushing. However, the other version, which is the higher Km, acetaldehyde dehydrogenase, meaning it has lower affinity. So unless acetaldehyde is present in high amounts, it won't work. And those people who has higher Km version of acetaldehyde dehydrogenase get symptoms of hangover. I hope this is clear. Okay, now alhamdulillah, we finished with our first concept. Now we'll be talking about allosteric enzymes. So you see here we have a metabolic pathway. We have the substrate A, E, and the product A and the product E. So when we have enough amount of products, this product can go back and downregulate the metabolic pathway, and this is called negative feedback. However, when we have high amount of the substrate, this will push the pathway toward the product, and this is called positive feedback. Now, in some cases, we have both positive and negative feedback. Now, allosteric enzymes. So I have two types of enzyme, allosteric enzymes and McCall-Smithon enzymes. Allosteric enzymes, basically, first, they catalyze the rate-limiting step in metabolic pathway. And I'm sure by now you all know what does rate-limiting step mean. It basically means, for example, we have here A, the substrate, and the final product is F. After A is gets converted to B by the rate-limiting enzyme, there is no way back. It can't reverse back to A. It can't stop at C, and there is no way back. It will go all the way and give us the product F. That's what does committed step or rate-limiting step mean. And basically, those enzymes that catalyze this step, we call them allosteric enzyme. The other enzyme E2 that was say the remaining step are called McCall-Smithon enzyme. Now, allosteric enzyme differ in 3 points from the McCall-Smithon enzyme. First, they are allosteric enzyme. From their name, they have an allosteric site. So what does allosteric site mean? So we have here the enzyme, and let's say this is the enzyme. Here we should have an active site for the substrate to bind. Those allosteric enzymes, they have also an allosteric site. Allosteric site means this site, any other modulator can come, bind here, and either enhance the activity of the enzyme or diminish or downregulate the activity of this enzyme. The second characteristic is that they have multiple active sites. So other enzymes only have one active site. However, the allosteric enzyme can have 2, 3, or even 3, or even 4 or multiple subunits of active site. So more than one substrate can bind at the same time. And the third characteristic is that they present at 2 states, the R state and the T state. So the R state, or the relaxed state, basically, so we can imagine it like when the enzyme is welcoming more substrate and it's open for its substrate to bind. However, the T state or the tense state, it happens when the enzyme is as if it is closed and less welcoming for the substrate to bind. So R state present, of course, when we have higher amount of substrate. T state is present when we have lower amount of the substrate. Let's take an example for an allosteric enzyme. Let's say hemoglobin. Hemoglobin is the protein in RBCs that carries oxygen to our tissue. So we said allosteric enzyme or allosteric molecules have 3 characteristics, and let's apply it here to hemoglobin. So we said first they have allosteric site. So hemoglobin that regulate these enzymes. So hemoglobin, in case of hypoxia or anemia, where there's low oxygen present in the blood, you want to give your tissue as much as any oxygen in your blood. You want to give it to the tissue. You don't want any oxygen stays bound to hemoglobin. However, you want it to be delivered easily to the tissues. So in cases of hypoxia and anemia, there is a molecule that's called 2,3-BPG. That will increase, and this molecule, when it increases, it will go and bind to the allosteric site of hemoglobin, and it will stabilize the T state. So it will make hemoglobin less welcoming to the binding of oxygen. So oxygen will get released to our tissues easily. So this is the first characteristic. The second characteristic was that those enzymes, those allosteric enzymes, have multiple unit or multiple active sites. So hemoglobin has 4 active sites for oxygen. So one oxygen can bind here, and one molecule of oxygen can bind here, and another here, and the last can bind here. Lastly, we said they can present in R and T state. Now hemoglobin, we said the T state is it's as if the enzyme is closed and less welcoming for the substrate to bind. So let's say we have 4 free active sites, and the first oxygen come and bind here. Now, when the first oxygen come and bind here, okay, I will finish this part and then I will repeat. So when the oxygen come and bind here, the second part, or the second site opens for the second oxygen, and the second oxygen find it easier to bind. Now the second oxygen got or bind to its site, the third site will open, and it will be even more easier for the third oxygen to come and open. And when the third oxygen come and bind, it will be even easier for the fourth, the site will open, and it will be more easier for the fourth oxygen to come and bind. Now, this is how hemoglobin gets converted from the T state to the R state. So T state when it was fully closed, and R state when all of the sites were open and were occupied. And this phenomenon basically called the cooperativity phenomenon. And that's why you see here we have the blue curve, which is the Michaelis-Menten curve, or the hyperbolic curve that we were explaining. And the green curve is the sigmoidal curve, or the curve for allosteric enzyme, the curve that allosteric enzyme show. You see the curve is it's as if it is two combined curves, because the upper one would be the R when the enzyme in the R state. So the substrate, when substrate bind, when more substrate bind, the velocity increases much more than the velocity when it in the T state, because T state, you see, as we are adding substrate, however, the velocity is not increasing as much, because in the T state we said the enzyme is not welcoming any substrate to bind, so it's harder, so the velocity will not increase that much. So that's why we end up with a sigmoidal curve, which is basically the combination of R and T state. So now, which part of hemoglobin you didn't understand? The first part. So the okay, the fact that they have an allosteric enzyme. So hemoglobin gets regulated by many molecules, and one of them, I'm just giving one example, which is 2, 3, B, P, G. So this molecule increases in response to hypoxia when there is low oxygen in your blood, or anemia. So basically, when there is low oxygen in your blood, you want your tissue to get the oxygen easily, and you don't want any oxygen to stay bound to hemoglobin. You want it to be released in the tissue. So when this molecule increase because you have hypoxia or anemia, it go to the hemoglobin and stabilize it in the T state. What does T state mean? It make it closed or less welcoming for the substrate to bind. Basically, it releases the substrate. The substrate here is oxygen. So oxygen get delivered to the tissue easily. So what does allosteric site mean? Or allosteric regulation here in the context of hemoglobin. Is that okay? You're welcome. Okay. Here's the same. It explains the same thing that we talked about. T state, R state, and how they regulate the enzyme, either enhancing or decreasing its activity. Okay, here's clinical insight. So basically, you have a disease called gout. So in gout, we have increased level of uric acid. And when this uric acid molecule increases, they crystallize together and form crystals. And these crystals can deposit anywhere in the body. For one example would be here, it deposited in the joint and it causes joint inflammation or arthritis, or it can deposit in the kidney, for example, causing uric acid stones. Now, how does gout happen? So we know purine and pyrimidine, those are the nucleotides needed for the synthesis of DNA. So in purine pathway, in purine synthesis pathway, we have the PRS enzyme, which is an allosteric enzyme, a rate limiting step enzyme. And I said rate limiting step enzymes are tightly regulated by the body because we don't want any overproduction or underproduction. However, sometimes we have a mutation in this enzyme that doesn't that the actives, not the active site, the allosteric site doesn't respond to the regulation. So PRS would be hyperactive, and we would have overproduction of purine. And because we have excess purine that we don't use, this purine nucleotides will be degraded. The degradation, the product or the metabolite of their degradation is uric acid, and that's how we end up with gout. Okay, now we finished with our second concept, the allosteric enzymes. And we'll move to the third and final concept, which is enzyme inhibitors. Is everything before this okay? Okay, perfect. Okay, so as you learned before, enzymes can be regulated or affected by many factors. One of them would be environmental condition, where pH, temperature, and other factors that can affect them. The second would be the presence or absence of cofactors or coenzymes, and the third would be enzyme inhibitors. Now, when we say enzyme inhibitors, from its name, it's any molecule, basically any chemical that decreases the ability of the enzyme to catalyze its reaction. And generally, we have two broad categories of enzyme inhibitors. We have the irreversible and the reversible type. Now, the irreversible, from their name, because they are irreversible, once they bind to the enzyme, they deactivate it permanently. So it can't work or function again. Even if you remove the inhibitor, it's gone forever. And in order for them to do that, they need to bind to the enzyme strongly, and that's achieved by covalent bond. Now, for the reversible, once you remove the inhibitor, the enzyme can go back to its normal activity. So it binds by weak interactions or weak bond, and here are the examples. And we have three types of reversible inhibitors. We have the competitive, we have the non-competitive, and uncompetitive. Okay, so first, irreversible inhibition. Okay, so irreversible inhibition is that the enzyme gets inactivated permanently, and it's achieved by covalent bond. So here's an example. It's saying for you at the neuromuscular junction, basically where the nerve and muscle meet. So if you want this muscle, for example, to contract, the nerve fire, and firing of the nerve will release acetylcholine. Now this acetylcholine will bind to its receptor on the muscle, and muscle contraction will happen. After the muscle contraction, we are done. We don't need any contraction anymore. Acetylcholine esterase will come and degrade these acetylcholine, and the contraction will be terminated. Now, in some pesticides and nerve gases, they contain organophosphorus molecule. This organophosphorus molecule, it inhibits acetylcholine esterase activity, so that acetylcholine molecules cannot be degraded. So they persist, and they bind to their enzyme receptors and activate it for a longer time persistently. So the receptors first will respond. However, after some period of time, because of the permanent and persistent activation, they will not respond anymore. So those patients with intoxication will present with muscle weakness, tremors, and fasciculation. Okay, now for the reversible inhibitors, first we said we have three types. The first type is competitive inhibitor. Now, from its name, it's a competitive. So it competes with the substrate on the same active site. So in order for it to compete on the same site, we design it in a way that is structurally similar to the substrate. The inhibitor we design in a way that is similar to the substrate structurally, so that they bind at the same active site. However, when the inhibitor binds, binds, however, it binds ineffectively, so the reaction cannot happen. So, okay. So when we said enzyme kinetics, and we can differentiate between types of inhibitors based on Km and VMAX. And we said we'll go back to this graph again. So here we go. Now, in competitive inhibitors, what would happen for the Km and VMAX? Let me remind you that the Km represent the affinity of the enzyme to its substrate. The VMAX represent the ability of the enzyme to catalyze its reaction. So what do you think? Would the Km increase or decrease in this case, or wouldn't change? Km decrease, really? Yeah, lower affinity, so higher Km or lower Km. Yeah, exactly. The Km would increase. Why? Because now the substrate is not binding. Yeah, it's okay. Because the substrate now is not binding to its enzyme. So affinity binding is gone. So Km would increase because you have lower affinity. So Km would be high. How about Vmax? What would happen for Vmax? Would the enzyme be still able to catalyze its reaction? Let's say you have 3 enzymes. Doesn't change exactly. Because let's say that you have 3 enzymes, you added 2 inhibitors. Yeah, it doesn't change exactly, perfect. It doesn't change. You added 2 inhibitors. Those 2 inhibitors bound to 2 enzymes. However, the third enzyme managed to bind to its substrate. Now, would this enzyme be able to reach its Vmax? Yes, it would be able. Why? Because if you overcome the inhibitor by adding much more substrate, the inhibitor would be diluted and the substrate will manage to get to their enzymes and the reaction will happen as if there are no inhibitor. So perfect, we said Km increases and Vmax doesn't change. You remember the graph we talked about earlier, where the y-intercept represent 1 over Vmax, and the x-intercept represent -1 over Km, and the slope represent Vmax over Km over Vmax. Now let me ask you, which one of those has the highest concentration of the inhibitor, and which one has no inhibitor? Now we said Vmax doesn't change, so you see here all of them are present in 1 point because Vmax doesn't changing. So we are now relying on Km to decide. Let's say this one, this two, and this is the third. Which one of them would have no inhibition or no inhibitor? What do you think? Okay, some of you are saying 1 and other are saying 3. One has the highest affinity, correct? So the lower Km, correct. Now remember that this point 1, 2, 3, or it's actually -1, -2, and -3. Now when we take -1, for example, here, -1 equals -1 over Km. So a simple mathematics and we convert the Km in one side, we will get 1. So this point would represent 1. This point, when we do the same thing again, would represent half. Half. And here, it would represent third. So as we go this way, the Km decreases. No, I made a mistake here. Give me a second. Yeah, okay, I'm back. So here the higher Km, so here would be higher Km, and as we go here, we would have lower Km. So 1 would represent lower affinity, I mean no inhibition. However, the third one, you see it coming here toward 1, and we said 1 has the higher Km, so the lowest affinity. Is that okay? Is that clear? So 1 would have the highest concentration of inhibition because you see the Km is the highest one, and the second graph has half Km. The Km for it, it's half, so it's more. It has more affinity, and the first graph has the lowest Km, so the higher affinity. So there is no inhibitor. Is this point clear? Okay, perfect. Moving to here's an example of competitive inhibitors. So I'm patient with the highest Km would be this one. Yes, 3. So here we add this graph represent higher inhibition. You're welcome. So here statins as an example of competitive inhibitors, basically in patients with hyperlipidemia, dyslipidemia, or hypercholesterolemia, we give them statins. Why? Because statins basically inhibit the HMG co-iridactase enzyme, which is basically the rate-limiting step in cholesterol synthesis. So by inhibiting cholesterol synthesis, we can decrease their high levels of cholesterol and lipid in blood. Now moving to the non-competitive inhibitor. Now from its name, none. So we are not competing on the active site. So the substrate can still bind to its active site. However, the non-competitive inhibitor can bind to either the enzyme substrate complex. So once the enzyme and its substrate bound, they can bind, or they can bind with the enzyme before its substrate bind to it. Now, when the inhibitor binds to the enzyme or the enzyme substrate complex, it diminishes its activity. So that's the effect of non-competitive inhibitors. So let's see how do they affect Km and VMAX. So what would happen for Km? Km meaning the affinity or the binding of an enzyme to its substrate. Would it increase, decrease, no change? We said here, the substrate can still bind to its enzyme. Doesn't change exactly because you see, substrate can still bind to its enzyme. So Km doesn't change in non-competitive. How about the VMAX, which is the ability of the enzyme to catalyze its reaction? Would it increase, decrease, or no change? Decrease, exactly. Now that's the inhibitor is binding, the enzyme activity will be much more or less. So it's not as effective as if there was no inhibitor. So Vmax would decrease, however, Km will not change. So, and we said, as we said, x-intercept is the Km. So you see here all of them almost at the same point. There is no much change. Y-axis or y-intercept is 1 over Vmax. So which one of them do you think has the highest inhibition? This is 1, this is 2, and this is 3. Highest constant, 3, exactly. As we go up, the Vmax decreases because this, let's say this is 1, this is 2, and this is 3, the same thing we counted for Km. Basically, you don't go and say, oh, 3 is the Vmax. No, it's 3 equal 1 over Vmax. So by simple math calculation, Vmax would be third. So here Vmax would be half, and here Vmax would be 1. So as we go up, Vmax decreases. Yeah, so yes, this one has the highest concentration of inhibition. And for the last type, the uncompetitive inhibitors. So uncompetitive inhibitors, from their name, they don't compete on the same site with the substrate. The substrate still can bind to its enzyme. However, the uncompetitive doesn't bind until the substrate and enzyme is bound together. So once the enzyme bind to its substrate, these uncompetitive inhibitors come and bind to them. And when they bind, they basically make the binding of the substrate to enzyme is so tight that the substrate cannot go anywhere, cannot be converted to a product, and basically it just increase the binding of the enzyme to substrate to each other, and nothing happen. We can't have a conversion of substrate to product. The enzyme cannot go and bind to other substrate. So they just stay in this state. So what would happen, or what would be the change for Km and Vmax? First, let's say Km, and we said Km is the ability for the substrate to bind to its enzyme. Decrease. But isn't the substrate is binding to its enzyme? So the affinity is still fine. They can still bind together. So decrease, increase, no change. I'm saying decrease is wrong because they still can bind to each other. No change. But we said when the inhibitor comes, it makes the substrate strongly bind or bound to its enzyme. That it cannot, you remember in the first slide we said the enzyme and the enzyme substrate can dissociate, and before go back to their state, substrate enzyme state, and they can yield a product. But in this state, this uncompetitive inhibitors doesn't allow either of this. So with Km, yes, Km increase because you increase the affinity that doesn't, there is no dissociation. They will be bound in this state forever, not forever, but as long as the inhibitor is present. Okay, so Km would increase. No, actually Km would decrease. No, I'm confused. Km would decrease, the affinity would increase. I'm sorry for the first one who answered decrease and they said no. So affinity will increase, Km will decrease. So how about Vmax? With the enzyme would the enzyme be still able to catalyze its reaction? Increase, decrease, no change? No. طب if طب yeah, exactly, decrease. Because instead this inhibitor doesn't allow the enzyme to catalyze its reaction. Neither dissociate, neither catalyzing the reaction. So Vmax will decrease. And here's the graph. You see Vmax as we go up, it decreases. As we go to the right, the Km as we go right, Km would decrease also. So 3 would represent the highest concentration of inhibition. So this is it for the uncompetitive inhibitor. Is the 3 type of the enzyme, the type of enzymes clear? So Km increases and Vmax decreases. No, Km decreases and Vmax decreases. Km decreases, meaning the affinity of the enzyme to its substrate will increase the affinity. Vmax decreases, yes, because we cannot convert the substrate to a product. Is that clear? Perfect. Now this is the whole lecture. I hope it was clear. Now we have 2 questions to see if things were clear or not. Before that, does anyone have any questions? Okay, perfect. So let's see the first example or the first question. A kinetic analysis of the effect of a drug on an enzyme's activity was performed, and the results shown below were obtained. The drug would be best classified as which one of the following? So we can draw a line here and another one here. This is the y-axis, this is the x-axis. So what do you think? Here would be the Vmax, and here would be the Km. Is it a competitive inhibitor, non-competitive, uncompetitive, or a competitive activator, or non-competitive activator of the enzyme? So one of you is saying B and 2 are saying C. Let's see. So here the Km, and they're almost at the same point. So Km, no change. And here is the Vmax. When the drug is not present, here's the Vmax. And here with the presence of the drug. So which one is higher, has higher Vmax? Is it the blue or the purple curve or the purple line? Yeah, without the drug, because we said as we go up, Vmax decreases. So with the presence of the drug, Vmax will decrease. So according to the 3 types we took, the competitive, non-competitive, and uncompetitive. We said the competitive, Km, would increase, Vmax wouldn't change, so it's not competitive. The non-competitive, we said Km wouldn't change, however, Vmax would decrease. So yes, it is a non-competitive. C, for people who are saying uncompetitive. Now, I'm assuming you assumed that those 2 lines are parallel, and that's why you chose uncompetitive. However, after analyzing the Km, we saw that the Km is not changing, and we said in uncompetitive Km would decrease. So the curve would be here. The drug, the curve would be here. Km would decreasing, so the affinity would increase. However, Km here is almost, they are both almost at the same point. So the correct answer is B. Now for the final question. A 20-year-old female presents with fluctuating fatigue, drooping of her eyelids, and difficulty swallowing, and slurred speech. The patient is given a drug that affects the enzyme's activity, and kinetics analysis of the enzyme catalyzed reaction in the presence and absence of the drug is shown. So here's the curve, here is the lines. So we said y-intercept is Vmax. Is Vmax different for both? No, they are the same. So Vmax is not changing. How about Km? So I said as we go here, Km would decrease, affinity would increase. So in the presence of a drug, Km is higher. Exactly. So it's increased. Km is high, meaning lower affinity. So which type of inhibitor would give us high Km, lower affinity, and no change in Vmax? Exactly, A, competitive. Okay. And we are done with the lecture. If you have any questions, type them in the chat, please.